informing that a 38-year-old female Chinese patient under investigation is positive for the novel coronavirus 2019 DAS-nCoV.
I have come to the conclusion that stricter measures are necessary. Everyone will stay at home, leaving their houses only to buy food, medicine, and other basic necessary for survival in the coming days. We are at war against a vicious and invisible enemy, one that cannot be seen by the naked eye. I'm calling on the Secretary of Finance to generate. Nakaw ka, maghiram ka, walang pakialam, i-produce mo yung pera.
The COVID-19 health emergency is perhaps the toughest economic crisis most of our people will live through.
We welcome this day with high hopes of finally ending the COVID-19 pandemic in our country.
It was 1 year ago when we went on a lockdown. It was unprecedented. Walang katulad sa kasaysayan ng mundo. The National Capital Region was sealed off. No one was allowed to enter. No one was allowed to leave. Bawal pa nga lumabas ng bahay.
This lockdown lasted 5 or 45 days from March 17 to April 30. Bagamat nakakalabas na po tayo, nakakapag-mall na, nakakapagtrabaho na, para dun sa mga mayroon pang trabaho, our life in quarantine times or quarantine remains. We mark these unprecedented times by bringing together some of the people who helped define the way we live in the past 1 year. Magandang gabi, Pilipinas. Ako po si Cheryl Cosim. Join us in the next 2 hours as we try to get the right answers that will lead us to a definite direction.
At ako naman po si Robbie Alampay. Sama-sama nating sagutin, kamusta na po ba tayong lahat ang COVID-19 Townhall sa panahon ng pandemic.
At mga kapatid, live po tayo ngayon sa news, sa Signal, sa One News, sa Signal TV Channel 8 and Channel 250. Naka-livestream din po tayo sa ating YouTube at Facebook pages ng One News at 1PH.
You can be part of the discussion by posting your comments on our questions down below if you're following us by live stream. Susubukan nating basahin ang ilan sa mga to at the end of the program. Simulan po natin sa kasama nating dalawang nagpaunlak na makasama natin dito sa studio ngayong gabi. Our first guest is currently the Deputy Chief Implementer of the National Task Force on COVID-19. He is also the Presidential Advisor on Flagship Programs and Projects. At tinanong po namin siya before we went on air, tama ba itong ginagawa natin? And actually he said, no, you have to level up a bit. Kanina, naka-face shield lang kami. Sabi niya, we have to do face masks. Joining us is COVID-19 testing czar, Vince Dizon.
We also have the medical advisor of the National Task Force on COVID-19. Professor din po siya sa University of Manila at kabilang sa kanyang expertise ay trauma, surgery, and disaster medicine. We have Dr. Ted Herbosa.
For safety reasons, most of our other guests will be joining the discussions virtually via video conferencing. But before we start introducing the remaining guests, we would like to offer our sincerest condolences to Health Undersecretary Maria Rosario Vergere.
Isa po siya sa mga pumayag na magbigay ng kanyang oras para nga po sa talakayang ito. Pero last minute po ay naabisuhan po kami na pumanaw po ang kanyang ina kaninang madaling araw. Our thoughts and prayers are with Undersecretary Vergere in this trying time.
In her stead, we are joined tonight by the Director of the DOH Health Protection Bureau. She also serves as the Special Assistant to the Secretary of Health and has led a number of health briefings during the pandemic. We also have with us Dr. Beverly Ho.
We also have Congresswoman Stella Kimbo. She's the representative of Marikina City's 2nd District. Kimbo is an economist and she also served as a professor at the University of the Philippines.
Our next guest is infectious disease expert Dr. Benjamin Ko. He's the former director of the Food and Drug Administration and he is currently the chief of the UST Hospital Pediatric Infectious Disease Section.
Also joining us virtually is tourism spokesperson Benito Bengson Jr. He also serves as the agency's undersecretary for tourism development and planning and chair of the Tourism Research Board.
We have another infectious disease expert in our panel who is also a member of the Health Department's Technical Working Group. She is also the Division Chief of Infectious and Tropical Disease at the UP College of Medicine's Department of Pediatrics. Let's welcome Dr. Ana Ong Lim.
At para naman ulit sa economic side ng diskusyon, kasama po natin ang Presidential Advisor for Entrepreneurship and also the founder of Go Negosyo. He's also the President and CEO of RFM Corporation. Let's welcome Mr. Joey Concepcion.
And joining us all the way from the United States, a fellow of the Octa Research Group. He is a molecular biologist who's developing a COVID-19 yeast vaccine delivery system. We have Father Nicanor Austriaco.
At ngayong gabi, Robbie, isasantabi po muna natin ang politika para pakinggan po ang siyensya at ang ginagawang pagbabalanse sa kalusugan ng bayan, sa ekonomiya at kabuhayan ng mamamayan.
Lives and livelihood, as we keep saying,
Yes.
diba? And our guests keep reminding us. So we now proceed to the first part of our discussion, and we'll call this portion, well, it's actually our question. I mean, let me call in finally. We will try to bring in all our guests. As you can see, we have a long list of very esteemed people. We would invite everyone to jump in anytime that you want. But let me start with Secretary Vince Dizon. Let's start with that. It's been 1 year. We were looking forward to this program, no? Para magkumustahan. And I think 3 weeks ago, I think it's fair to say, 3 weeks ago, we would have thought that the context for this program would be so different. Diba? So, but let me start there. I mean, Sec, kamusta na ba tayo? How are we doing?
Thank you very much, Robbie. Alam niyo po, itong COVID-19, it is a challenge that I think is a once-in-a-generation pandemic that has wrought havoc across the entire world. It's probably the most difficult challenge that this generation, or maybe any generation, has ever faced. And our country, I think, has really borne a lot of the brunt, especially in terms of the devastating effects of this pandemic on the economy. Apart from the thousands of lives that have been lost, hundreds of thousands of livelihoods have been lost. And it is something that is really, really heart-wrenching, no? Because of what we have lost this past year. But I think right now, despite the huge surge in numbers, I think we are starting to see some ray of hope in the near horizon. In other countries that have started their vaccination programs, we have seen tremendous decreases in not only the numbers of cases, but also in the numbers of hospitalizations, and most especially the numbers of deaths have practically disappeared. And I think now that we started our vaccination program just 2 weeks and a half ago, or 2 weeks ago, I think this is the hope, the ray of hope, that I think we must all look forward to. But the most important thing right now is that despite the vaccination program having started, we really have to always remember that we have to always follow what our experts have said from the very beginning, that the most important weapon against COVID-19 is really what we are all doing right now here in the studio. We have to keep on wearing our masks. We have to wash our hands as often as we can, and we have to distance as much as we can and avoid crowds. This is the most important. 85%, all the experts have said that this is the most effective way of preventing transmission. Plus, we have to always remember that the strategies that worked last year when we experienced a similar surge sometime in July and August, detection, isolation, treatment, these must still be implemented, and more strictly now that we are experiencing this surge as we roll out the vaccination program. So, kumusta po tayo? Well, ngayon, mabigat po ang hinaharap natin dahil sa surge na ito. Napakabilis po, no? Aaminin po natin. And Dr. Ted will tell you firsthand. No? Just today po, I was going around isolation facilities in Central Luzon and Metro Manila, where most of our major isolation facilities are. And napupuno po tayo. And we have to add more, and we have to find creative ways of making sure that we have to isolate very, very quickly. So, but itong bakuna po, ito po ang talagang nagbibigay ng pag-asa sa ating lahat, and we need to up our game and we need to do it faster.
Yun po yung sinabi nyo, mabigat ang hinaharap natin. Gusto kong tanungin yung ibang guests natin, Robbie, maybe Dr. Ted Herbosa and also Dr. Beverly Ho. Kamusta na nga ba tayo? Kasi yan din ang gustong malaman, maintindihan ng mga tao na parang sinasabi ng pamahalaan, we're doing okay, pero nare-realize ba ng tao na mabigat nga pa rin yung hinaharap natin?
Thank you, Cheryl, Robbie, and Secretary Vince, all the other guests. I think I'll try to be the positive thing here. And I work in disaster medicine. Every place I work in, there's chaos, there's death, there's illness, and there's a lot of work. But in every disaster, in every crisis, there are many good things that happen. Leadership, heroism. We've discovered gaps in our health system we've never discovered before. We've realized how important our health workers are, that we export to other countries. They're glorified in other countries that also took a handle and a beating in their health systems were all beaten up as well. And some of our European and North American colleagues praised our own health workers. I'm proud of that. We've seen people, men on the street, and in our travels with Secretary Galvez as we implemented the National Action Plan, I saw people that were able to show the bayanihan, the very Filipino bayanihan concept, the approach of whole of society and whole of government to fight an invisible enemy. It was truly a big war, but when I look back after 1 year, I only look at the positive things. Friends and enemies work together against a common enemy, and we beat it. Our first round, we were able to flatten the curve after August. We with very strict implementation, we increased our testing. Our testings did a tremendous task. From zero, he built about 160 molecular labs. We didn't have molecular labs in the beginning. We were sending it to Melbourne, remember?
Yeah.
And after that, we realized we will never fight this if we didn't have the eyes to look at this, and we needed the laboratories. And when I watched how the molecular labs grew over the months and the targets, he did a great job. And I think we shouldn't forget all those successes. And then there was contact tracing. There was this Baguio mayor, used to be head of criminal investigation division of and used his skills and digital expertise to help the epidemiology surveillance unit. So there were many things happening that even me, I was very happy that very unique. And then there are many things we've done that's very Philippines. For example, Mr. Joey Concepcion signed up immediately in October, I think, or November, tripartite agreement with the government. The very first of its kind all over the world. Is that right, Secretary Vince? The very first of its kind. We're in the government, the private taipans and the big people helped each other to get access to vaccines. So there are many good things. So I'll try to look at the good side, even if we have a surge now.
Yes.
That's the nature of the virus. That's
Yeah,
the
but-
nature of illness. That's the nature of disease. We have to keep fighting. We shouldn't give up, and we should continue.
I thank you for that, Dr. Ted Herbosa. No? I mean, to frame it in that sense. I mean, si Cheryl called on Dr. Beverly Ho. And let me ask you to continue that looking back. And just by way of also reminding and framing this entire conversation, that we want to start off by taking a one-year perspective.
Yes.
Given everything that's happened over the past 3 weeks, it's inevitable, and we will get to that later on, the immediate context that we're now in. But we do want to start with, what's the one-year context? What do you remember from the chaos and the confusion and the panic and the urgency of a year ago? And when you look back at that, what do you objectively see as things where we have progressed, some things we may have missed, and so on? What stands out for you?
So clearly, the investments that Dr. Ted has mentioned. No? So we started with one laboratory, and now we have around 229 labs servicing the entire country. We started with 300 tests per day, and now we've tested a total of around 9 million samples. And finally, we did have one isolation facility very early on in New Clark City, and now we have around 9,000, diba? So hindi naman yun nabibuild overnight. I think from us, people working in the health sector for a long time, we know that there have been challenges, primarily in investments, in facilities, and in human resources, far longer than when the pandemic started. It was already there. We also know that ownership has to be with local governments, primarily, who are the stewards of the healthcare system, it being devolved to them. And also, we also know that for any health program to work, community has to be involved. Pero madaling sabihin, actually mahirap gawin, no? And during this pandemic, we had no choice but to make sure all of these gaps that we've had prior to COVID-19 pandemic had to work hand in hand all together. So minsan nakakalimutan pa rin natin, naisip natin, ay, ang health ba ay trabaho lang, no? Public service lang, trabaho siya ng gobyerno, binibigay siya. But unfortunately, it is not, no? It is something that the authorities, the private sector, and even those who supposedly receive it are actually co-owners of the health care process. So I think these are very important lessons, which many of the key stakeholders, not only in health, but outside of health, have learned, and this has made us perhaps less reactive, more collaborative, and I would say that we will definitely come out of the pandemic with a stronger health system, not yet obviously as perfect as what we will see in other countries, but significantly better than when we had it early 2020.
Okay. It seems like marami tayong natutunan, pero kagaya ng sinabi mo, Sec Vince, may mga hinaharap pa tayo. At isa po dito sa ating mga guest, itong mga samot-saring variants. May variants mula sa Brazil, meron tayong mula sa South Africa, UK, at meron na rin tayong, paano ba natin tatawagin? Pinoy variant? Filipino variant, Brazil, diba? So how are we responding? How is the government responding to the spread of these variants now? Maybe, I don't know, Father Nick or Dr. Ho? Go ahead. Naka-mute po yata si Father
Nick?
Austria.
So,
Ayan po.
so I would like, I'm a Filipino-American, and so I would like to point out, first of all, looking back at the year, how incredibly proud I am of the way the Philippines has dealt with the crisis. Because I can compare my two home countries. I can compare the numbers, I can compare the deaths. And when I speak here in the United States about the relatively low numbers that we have as compared to in the Philippines, as compared to the States, they are completely shocked that the Filipino people have been able to keep the numbers down, especially given the limited resources that we have. So here in the US, for example, at the university where I currently serve, we are able to test every single person on our community twice a week. So this university will undertake, just this university, about 2,000 tests a day in order to manage our pandemic. And I always tell the president here, if only the Philippines could have that kind of capacity where we would be able to test, millions of people a day, but we don't. We are where we are in the world, and our given the resources we have. I'm incredibly grateful for the numbers that we have been able to keep down. Now, with regards to the variants, I have to say that I'm scheduled to return home to the Philippines this week, but I'm going to delay my return because of the surge going on right now, especially in the NCR. And I am prepared. I am doubly vaccinated, but I am prepared to go into quarantine as soon as I land in Manila. And one of the disappointing things is that the quarantine has been leaky, because the variants, there have been countries in Southeast Asia that have been able to keep the variants out. And I know we have particular challenges, especially because of the large numbers of OFWs who have to return home, that we've struggled with these large numbers. And yet, now we have the P1 Brazilian variant, which from a molecular biologist perspective is really one of the largest challenges we will have facing the future if we were not able to contain that. So in terms of just, observing the variants right now, we have a large, as Dr. Anna pointed out in a news report, this surge is not only about variants, but it is a part of the conversation that we have these variants, especially the B117. That would explain the dramatic and explosive numbers that we have seen in the last 2 weeks. And yet, as the numbers seem to bear out from the Philippine Genome Center, it's not just the variants, because the numbers are not significantly variant driven, but there's going to be some effect. So the question here now is, we have one P1. Are we going to do something to prevent more P1s from entering? Because the P1 of all, it combines the worst of the other two. It combines the worst of the UK and South African variants from a molecular perspective. And so that's a challenge we will face in the weeks and months ahead.
Father Nick, if I may follow up also by way of prompting the other doctors on our panel. So we started off by framing, what's improved, what is now in place for over the past year. And like I said, 3 weeks ago, we would have thought that, okay, we're going to have a pretty optimistic program come the 1 year mark. And then all of a sudden, everything's turned around. You now see the numbers for us trending upwards. Even as you mentioned, if you look at our neighboring countries, never mind the United States, but you look at our neighboring countries, you look at Indonesia, for example, nominally much higher cases, but clearly trending downwards. So I want to bring it from the 1 year perspective now to just literally the perspective of the past 2 weeks. What's the more important context for us? As we ask ourselves, where are we headed now? Is it the longer term picture that we just painted, that look, everything is in place? Or is it the immediate short term picture that we've been having, that notwithstanding all of those things in place, things seems to be getting worse?
Well, we are certainly at a significant advantage over where we were a year ago. But the virus is also changed in a year, right? So it's important to keep in mind that it's the same virus, but it's a new variant, and so it's a new beast. And so countries around the world, we are not the only ones undergoing a surge at the moment. There are countries in Europe that have also experienced a B117-driven surge. And they have had to go into lockdowns. So they are going to their second, third, or sometimes fourth nationwide lockdown because they discovered that they were not able to contain this explosive growth. And so the question now that is facing the government and our LGUs in the next week or 2 weeks is really, what sort of things can we do at the moment to drop the reproductive number, which is approaching 2, which is unprecedented in the pandemic in the Philippines. It's approaching 2, especially in the NCR.
Okay, so Doctor, yeah, go ahead.
Sorry, if I could just add, thank you so much, Father, for your for your invaluable inputs. But I think just to answer Robbie's question directly, what we've learned in the past year, the here and now is always the most important while we're fighting COVID-19. We always have to be focused on what we are going through at the present moment. Because really, this virus is so insidious that it can strike any time. And we always have to make sure that we are ready for any eventuality. And right now, what we have to do is what we've already what we have seen to be successful when we experience a similar surge, which is prevention, the minimum health standards, detection, isolation, and treatment. The only ray of hope that we have now that we did not have last year is that we're already starting the vaccination program.
Yes.
So this is especially important for our healthcare system. That's why Dr. Ana Ong Lim, together with the NITAG, they have always emphasized any vaccine that comes into the country now must be for our healthcare workers because they're the ones in the front lines. They're the ones who are going to have to deal with the surge that we're experiencing now, and we have to protect them. We have to protect them because in protecting them, we are protecting our citizens who are going to get sick.
Okay. And thank you for that perspective and that reminder. No? But of course, we're asking all of this because, as we said, later on, as quickly as we could, we'll try to bring in the people on our panel having to deal with the livelihood side of this conversation. And the part of our checking our emotions and optimism or pessimism right now is really the fact that nabitin tayo dun eh. We were really looking forward to hearing more from the economic managers and the private sector because 3 weeks ago we were thinking everything was all about reopening, people can travel again, and so on. So we'll get to that, but I just want to quickly check Dr. Ana Ong Lim, Dr. Benjamin Ko. I guess if I were to boil down my question is, after everything that's been mentioned and everything is correct and fair, what's the prevailing emotion and sentiment for you? Is it optimism? Is it pessimism? And what is it? How would you describe it, given the long term and the immediate context?
It's a very difficult question to answer, Robbie, because if I was going to say I'm optimistic right now, that wouldn't be a valid assessment of our current situation. Obviously, we have a problem. We weren't in this situation earlier last month. The numbers started climbing middle of February. And I think we had actually gone we had actually left that period after the expected surge with some optimism. Because if you remember, coming from the Christmas holidays, the health sector kept warning, please, please don't go out, please, please, because we can't afford another surge. And I guess it worked because our uptick wasn't so bad. But then starting the 15th, we had 2,000 cases a day. When March came in, we had 3,000 cases a day. And now our numbers are actually higher than they were in July or August. If you look at the graphs, it's a very obvious picture.
Yeah.
So what am I feeling? Nakakunot na yung noo ko mula po nung February 15. Parang hindi pa nare-release yung kunot ng noo ko. Kasi parang ang daming kailangan gawin. I think the challenge is we need to move double time because even as we say that the variants are not making up a significant proportion of what we're isolating, this feels like it's moving faster. And I think we can't afford to not think of the worst case scenario.
So,
Yeah.
Doc Ana and Dr. Ko, dun sa sinabi niyo po na we need to move faster. Although yung variants ngayon, we don't even know kung gaano karami sila dun sa total cases natin, but we see really the trend going up. So, babalikan ko yung tanong ko, paano tayo responde ang pamahalaan on this problem, and ano pa yung gagawin natin? Kasi parang yesterday, sabi nyo nga po, the numbers were at 5,000. And possible na by today, mas mataas pa sa 5,000. So talagang hindi lang naman sa pamahalaan natin sinasabi ang may dapat ginagawa. I think tayong mga tao ay naging komportable. Parang nakalimutan natin na may COVID. Ngayon naririnig natin na may mga bagong variants and yung transmissibility niya ay mas grabe. Mas nakakahawa po ito, mga kapatid. Hindi namin kayo tinatakot pero mas mabilis makahawa. So, yung pagiging matigas ng ulo natin, or sabi ko nga, komportable na parang normal na ulit, nakalimutan na yung new normal. So, ano po ang kailangan natin gawin? Anong ginagawa ng pamahalaan? Ano yung mga adjustment? Dr. Ko and Dr. Ana Onglim.
Just to add to what Anna was saying, I just second the motion. To me, it's a feeling, like a few months ago, it was a feeling of optimism, real good optimism at seeing how beautiful the numbers were, particularly in the national capital region, where we were able to bring the numbers quite low. And then we were looking at already the coming of the vaccines. So that was something that was really anticipated. And Anna is right when she says that we were warning everybody post-Christmas holidays. We were anticipating the worst after the celebrations in January, but it never happened. So it looked like we were going for the gold.
Yeah.
But unfortunately, the story didn't want to end there. And in hindsight, maybe, it's just maybe, it's not blaming anybody, but maybe because we had some mixed messages coming from certain sectors in the government that was not really aligned with the current data that we have. Like, for example, it was not really wise to say that, okay, we can just go on opening the economy in totality without looking back at the data, because by the time they were saying that, the numbers are really on the rise. And I understand actually from an economic standpoint that there really should be a recalibration of how to utilize the lockdowns and the lockdown measures so that we find a balance between the economy and health. That there must be a balance between the two and a gauge on what numbers we can use. But there really is no science that tells you, okay, when the numbers are this low, then it's okay to go ahead and open which part of the economy. And then, of course, you come to the point wherein this was just a matter of timing. The surge was bound to happen somewhere.
Yeah.
Unfortunately, as Father Nick had said, we had some leaky borders and some problems, because we really will not be coming down with these variants if we had addressed them from the very beginning.
Yeah. Secretary.
And pandemic fatigue is something that is real.
Yeah.
I guess not only for the Philippines, but for everyone all over the world.
Secretary
So,
Dizon, thank you, Dr. Ko. Secretary Dizon will need to take a break in a while, but I just wanted to get this in. And I don't know, I don't intend to necessarily speak for the scientists and the doctors and the public health officials, but going to something that I think was expressed by our good doctors, something that we've been feeling the past weeks also. I mean, as we guested public health officials and then government officials and so on, part of the mixed messaging really had to do with just acknowledging whether or not this is the variant, whether or not the variants were driving it. But consistently, the messaging from government has always been, look, doesn't matter. I mean, I know I'm oversimplifying it, no? But look, it doesn't matter what the cause is. It's still the best practices. But that message has been drilled into the people for the longest time, giving them all the benefit of the doubt. I think one of the questions that we want to get on the same page on is there still any debate that any policy or program or intervention has to proceed on the assumption that the variants are here and are major factors in the rising numbers?
I think the fact that the variants are here is uncontestable. They are here. No, but I'd rather not talk about the science of the variants and how they are causing the surge or how much they are causing the surge. I'd leave that to the likes of Dr. Anna and Dr. Benjamin Ko. But I think what we have to all understand is that last year, in July and August, our cases in Metro Manila were at 4,000 to 4,500 daily. Right now, they are at 1,500, 2,000 daily. We were able to address that by following the National Action Plan of prevention, detection, isolation, and treatment, all the way down to the barangay level. And people at that time, because of the interventions, especially the local government units and even the private companies, they followed. No? And because of our added capacity to test, to isolate, we were able to bring those numbers down up until a couple of weeks ago. So I think we have to stick to what worked. No? And I've heard the experts all say that regardless of the variant, the most powerful weapon against COVID-19 is still the diligent practice of the minimum health standards. Just to give an example, Father is right now in the US. When there was a change in administration in the US, and when the national mask policy was one of the first executive orders signed by the new US president, the numbers just went down dramatically. Of course, this also coincided with the more aggressive vaccination rollout. No? But I think the science is clear and the strategies are clear. We just really have to come together, do what we did last year, and make it work. I think we just have to work together in the same way that we pulled together last year.
Okay, Secretary Dizon and everybody, as we said, we just need to take a break. As we said, we're talking about lives and livelihood, buhay at kabuhayan. Pagbalik po natin, pag-usapan natin yung livelihood at kabuhayan. Ito po ang Kamusta na ba tayo ay One News Town Hall on the COVID-19 pandemic. We will be right back.
Nagbabalik ang Kumusta na ba tayo? Ang COVID-19 Town Hall sa panahon ng pandemic. Dali, tatanggalin ko yung sarap ko. Ano ba, paano ko ba babalansihin? Ang hirap eh. Okay, balik natin. Halos isang taon na po noong ipinatupad ni Pangulong Rodrigo Duterte ang Enhanced Community Quarantine. Ang naging hudyat na magbabago nga ang buhay natin dahil sa pandemya. Ito na ang pinakamalapit na karanasan natin sa kasabihang tumigil ang mundo.
Nawala ng traffic sa kalsada dahil halos lahat ng nakakulong sa bahay. Piling tao lang din ang nakakalabas at pahirapan ang pagpila ng mga bilihin para sa mga bilihin ng essential goods gaya ng pagkain at gamot. So let's get back to those first few months when we were in strict lockdown, ang buhay quarantine.
Okay, hapon po ng March 16, 2020 nang formal na ibaba ang utos na ilalagay sa Enhanced Community Quarantine ang buong Luzon. And on that day, we already have 142 confirmed cases and our first case was logged on January 30, 2020. In hindsight, were we late? Ano po, mga kapatid. So, yan ang gusto nating pag-usapan din ngayon and also yung takbo ng ekonomiya, ang daming nawalan ng trabaho, di ba, Robbie?
Actually, ako, we'll take that to bring in the people who have been trying to manage under, trying to work with the economy such as it was. Particularly, we want to start, umpisa po tayo kay Mr. Joey Concepcion. Mr. Concepcion, as we said, let me start this off. I mean, 3 weeks ago, everything was hopeful. The headlines were dominated by, if not the vaccines, the whole idea of we'll open up some more. Let me start with the first question that we started off with specifically para po sa ating mga businessmen, sa ating mga negosyante, sa ating mga entrepreneurs. Sir, kamusta na po tayo?
Well, Cheryl, Robbie, I mean, 12 months, basically. We've made mistakes. We've learned a lot. This kind of a problem, nobody in the world ever studied about it. Nobody ever experienced it. So what do you really expect? No, it's a process. We learn through our mistakes. We gain insights. And the private sector, in a way, has gotten to really get more involved. And that's where I see that the ray of hope. And we've matured in our ways of really trying to work intensely with government, public sector. And this partnership between the private and public sector is essential, and especially with the citizens, to get through this crisis. And we're at war with COVID-19. The first phase of the war was to coexist with the virus, basically. We didn't have any weapon to kill the virus. All what we had are basically to protect ourselves using face masks and face shields and social distancing. And basically, that was what we had. And plus all the test kits, of course, initially we had nothing as Vince created all of these labs. But we only had very few capacity. And how do you determine visibility? How do you find the enemy without testing? And so we resorted to a maybe not as accurate as PCR, which we got into a controversy with the medical group, and I'm glad we solved that. Using the antibody test kits was the only way the private sector creates some kind of visibility. It was not perfect, but we moved on. We went to antigen. We supported the government with donating PCR equipments, both for even Red Cross. Many of the private sector companies helped. And then we started more innovations toward PCR testing, and now we're doing a research on saliva PCR testing, and other testing innovations are coming in. And I guess the first 12 months was really trying to see how we can best balance both lives and livelihoods. But it's very difficult because the new normal actually does not make many businesses viable, and that's why you've seen the economy really take a really big hit, no, in 2020, whereby many of the MSMEs have basically shut down because of poor viability. The bigger companies like the SMs and Robinsons gave free rent basically through that crisis, almost 1 year. No? If not for that, then many of them will even close longer. So we are really coping in this crisis. Now, is there hope? Definitely there's hope. I mean, as an entrepreneur, the moment you lose hope, might as well forget everything, and we will lose more lives and livelihoods. And I look at it differently. So we are at this stage now that we have what we call a nuclear warhead that we can eliminate this COVID-19. And these are the vaccines. Prior to this, it's just coexisting. Now, how do we win the war? That's the most important thing. And that's why the private sector now is very involved with bringing the vaccines. And we launched the Dose of Hope last year with AstraZeneca vaccines. It is the first contract that we signed under the tripartite agreement with the national government. This is the first documented order of vaccines for the Philippines. And I would like to thank, of course, Secretary Galvez and Vince Dizon and the rest for really helping us form this tripartite agreement, because it actually mirrored now many more tripartite agreements with the entry of Moderna, with the entry of Novavax, and now we're also bringing the Indian vaccine, Covaxin, under Bharat. Now, why is this essential? We know that things will shake. In life, nothing is always perfect. You will have, cases moving up, cases moving down. Now we have something that can beat this COVID-19. It's a matter of executing. So now Secretary Galvez is working hard. We are working hard to secure vaccines. Nowhere in the world does the private sector in any country in the world buys the vaccines and pays for it, and even will pay for the logistics and implementation. In the Philippines, we are taking that big role, despite many companies not being able to afford it. But we are going to do it because together as one, public, private, and even the LGUs, if we all come together and bring these vaccines, convince our citizens to take the vaccine, because we can bring all the vaccines, but if our citizens will not have the confidence to take the vaccines, then we're not going to win the war. Yeah. Of course, so that's very important. And we need the execution. We have to vaccinate as fast so that we beat the mutations. All of these things will just keep mutating. So we have to do this as fast as possible. And I believe that by the end of this year, things will be much better. And of course, we will have to do, and what we've planned in the past, granularized lockdown. I'm glad that we move in that direction, because that's the approach. So saving lives and livelihoods, you have to save both to the best you can, like two children drowning, you do your best. And that's what we're trying to do. And I'm optimistic that if we do this and roll out the vaccines and our citizens take that, then this problem will start to be on our side and we'll beat the COVID-19. Definitely. I'm positive about that.
Mr. Concepcion, I think malinaw naman sa lahat ng tao. And you were here in many of our programs, One News, emphasizing that, as everybody did, that the vaccines will be game changers. But the reality too is that, and this is why we keep asking about the variants, is because the variants are game changers. Because once we started the programs on trying to get the vaccines here, really the variants came, let's face it, after that, even entering the consciousness of the public after that. So the question to you, sir, is, as you said, you did, gaya po ng in-acknowledge nyo, there's this natural tension between those monitoring just the virus and those monitoring the economy. And you're right, in fairness to both sides, every time, everybody has said it has to be somewhere down the middle. Nobody has been really fundamentalist or extremist about it na, no, ito muna. Everybody agrees. But given that, the question now, sir, is, then what do we do? What do we do? Because 3 weeks ago, everybody seemed to be on board with, okay, we'll start to reopen. But the variants coming into the picture has really changed not just the game, but even the sentiment of people. You talk about, it's all about execution. But many people in the public health sector are saying, actually, before it becomes a game of execution, it's also a game of waiting. They were saying, antayin muna natin yung virus, yung vaccination. Pakagatin muna natin yung vaccination. And I know that message came across as well. And I'm sorry, I know this all still leads to a dilemma with no simple answer. But from the entrepreneurship and business perspective, given everything that seems to be undeniable over the past 2 weeks, what is the recommendation now?
Well, we have to take a pause now. You can see now that we have the curfew back. Certain areas of business will have to be on hold. All of these are being taken for 2 weeks at least. And I think it's a matter of calibrating. As the virus moves up, we take a pause, we pull back. Okay. Now the vaccines are going to be arriving. I think if we were able to secure more vaccines and get it to arrive, that required, the private sector, earlier on, people are asking, why did the vaccines arrive earlier? My point being is our law prevents us from taking a risk of putting money behind vaccines that have no FDA approval. So what did we do in the private sector? Last year, November 27, we put it down 50% for Astra vaccines that did not have their own MHRA approval, AstraZeneca. But we took a risk. It paid off. They got the MHRA after that. So what I'm trying to say now is that these vaccines are going to arrive. We can take a pause, and yes, as the vaccines start rolling out on May, June, and onward, there'll be much more in the third quarter. Then I think we have to see how these things move, but we have to plan. MSMEs are hit now. I believe that the fourth quarter will be a very strong quarter. I believe that the vaccines will start coming, especially from COVAX. You see AstraZeneca coming in, and I'm told that 5 million will be coming in through the period of May. Vince would know more. The private sector vaccines will all start coming in May. So we're projecting that. Now, when do you open up the economy? As we see the implementation, as we see these vaccines arrive, then that's the time to recalibrate, see whether the infections are going down, and start to open. Now, if it doesn't happen, then you hold off. No? So it's really a matter of trying to really, somebody piloting this whole thing. Now, we can't also forever shut down the economy because that's going to hurt. And we have seen that. No? By the time, the economic team is coming out with stimulus packages and all of that, and Congress passed it. But that's going to be useless when the economy is closed. You'll just be wasting all of that. So what I'm trying to say is balancing is difficult, and that's why working hand in hand with the public sector is very important to achieve the best balance. It's difficult, but we have to try to achieve the best balance, and that is what we're trying to do. The ultimate solution to this thing is getting the vaccines in and rolling it out. There's no other solution that I can think of. Wearing a face mask and face shields and all of that will be there forever, but that doesn't kill totally the virus. It is the vaccine that will eliminate this. And of course, there will be variants. That's why we have to speed it up in vaccinating our people. But we're only starting now, and so we have to give this a chance. No? So let's see what happens. I'm not saying open the economy openly and let's go and start allowing tons of people to the mall. I'm not saying that. I'm saying let's calibrate all the time. And if things are not going well, let's hold. No? Let's hold. And let's wait for the rollout. And as things improve, then you open it up again. No? And pull back if it's not. So I think that's the way to do it.
Isa sa pinakagrabe, the hardest hit din sa atin ay ang tourism. Naalala ko, na-excite ang lahat when Secretary Romulo, bubuksan na ang turismo pagdating ng January, but it didn't happen. At ngayon, eto na naman. But nakita natin yung dahan-dahan na pagbubukas. Dahil pag sinabi natin na tourism, hindi lang pamamasyal naman eh. Kabuhayan, sabi mo nga, Robbie, kabuhayan, trabaho ng marami nating mga kababayan ay apektado. Hindi lamang ng individual, mga negosyante rin. Undersecretary Bengzon, Yusek Bengzon, kamusta? Kamusta na ba tayo pagdating sa turismo?
Well, thank you, Cheryl and Robbie. Maybe I can just give you a summary of the year 2020 for tourism. As we all know, tourism has been the hardest, or at least one of the hardest hit sectors around the globe. Lockdown, many international borders were closed, restrictions were imposed, international flights were reduced. So necessarily this affected the flow of tourists around the world. In the latest report of the United Nations World Tourism Organization, it is estimated that global tourist arrivals went down by 74% last year. In the case of the Philippines, it was around 80%. With the reduction in arrivals, of course, we also experienced a reduction in revenue and, of course, also in employment. But one of the positive things that we saw in 2020 was that tourism was actually one of the first to craft a master plan for recovery. So barely 2 to 3 weeks after the lockdowns were announced, middle of March last year, Secretary Puyat already instructed us to craft this master plan, which would eventually be called the Tourism Response and Recovery Plan. And essentially, this is the blueprint to mitigate the negative impact of the pandemic on the tourism sector. We consulted our partners from the different companies, the hotels, the resorts, the travel agents, and the number one need that came out of the consultations was access to working capital. So we're very happy that through our partnership with the Small Business Corporation of the Department of Trade and Industry, and of course under Bayanihan too, we have managed to set aside about 6 billion pesos for working capital loans, particularly for micro, small, and medium enterprises. The other thing that we saw early on last year was that we were able to craft health and safety guidelines in all the critical touch points of the tourism value chain. So almost all the subsectors of tourism, from accommodations to tourist land transport, to restaurants, to convention facilities, now have their respective health and safety guidelines. We also made some adjustments in terms of our training programs, in terms of our product development, market development initiatives. So in a way, 2020 also provided an opportunity for us to be more innovative, creative in executing our programs. Obviously, we're seeing a shift towards a digital platform, and we're quite happy with the turnout that we saw last year. I think one thing that the Philippines ought to really maybe prioritize is domestic tourism. And again, the experience last year has compelled us to take a closer look at how domestic tourism can play a pivotal role in the recovery of the tourism industry as a whole. Very few know that domestic tourism actually generates much larger revenue compared to inbound tourism. Before the pandemic, our estimate is that domestic tourism generated over 3 trillion pesos compared to about 480 billion pesos generated from inbound revenue. So in the next several months, the focus will really be on domestic tourism. And one advantage that the Philippines has over its neighbors is that we have a very strong and very large domestic tourism base. 2019, we had about 110 million domestic trips. And we are confident that in the months to come, it will be the Filipinos themselves who will keep many of these enterprises afloat, providing revenue stream to the tourism enterprises, and of course, more importantly, providing livelihood to our workers. So I think 2021 will be a better year compared to 2020. We remain optimistic that the tourism industry will recover soon enough. Many of the destinations have already started to reopen. Secretary Puyat has been very busy the last several months moving around these destinations, consulting with the LGUs and agreeing in the opening up of the destinations. And as what the speakers earlier have already mentioned, the objective essentially is to achieve that optimum and delicate balance between economic and tourism activities on one hand, and making sure that the health and safety guidelines are still complied with on the other hand.
Yeah, and Yusek Bengson, and we certainly sympathize with everybody in the tourism sector, and for that matter, for everybody trying to get back up on their feet. And one of the things that is really hard is yung hindi namin alam kung saan lulugar eh, di ba? So for example, you mentioned the master plan, you mentioned everything that's in place, the protocols, But people are still asking, yeah, but what does that mean for me? What's the guidance for me? Whether I want to be a tourist or somebody as part of the tourism industry, what's the guidance for me? I'll give a very concrete example. Given all the context that we have right now, Holy Week is coming up.
Yeah.
And so what's the messaging over the next 2 weeks? I mean, do we encourage people to support domestic tourism? Or do we take the messaging from the public health sector that's, I think, if I'm hearing them right, saying na, teka muna, we cannot deny what's going on around us?
It will have to be situational. I think even in reopening the domestic destinations over the last several months, we took into consideration the incidents of COVID and of course the ability of the LGUs to address these health issues. And it will be the same for Holy Week. Of course, we want to help destinations get back on their feet by providing livelihood, but at the same time, we also recognize the importance of making sure that the health and safety protocols are in place. So the key message as we approach the Lenten season and the summer season is, yes, we encourage Filipinos to still travel, but mindful of the importance of following the minimum public health standards, and of course, following all the other requirements coming from the local government unit.
Okay, Congresswoman Kimbo, we'll bring you in. We have a question for you. We wanted you to jump in on here, but I just want to quickly bring in Secretary Dizon. Secretary Vince, I mean, on that particular question, and I think we'll revisit this later on. We were having this conversation earlier on about Holy Week. But just for that particular, what's the mindset, for example, for people so that they have a sense of how is government responding in real time to real-time data and information. So let's take the example of Holy Week. What is the policy? What is the direction? What is the messaging of government?
I think right now, as Secretary Concepcion correctly pointed out, when we deal with this pandemic, we have to be very flexible and we have to consider all possible options in terms of the response. And if the IATF, in its deliberations and upon the advice of our technical advisors and our doctors, feel that it may be prudent to make Holy Week, something more of like an extended holiday, where we are advising people to stay home, avoid crowds. This is something that we will consider. But again, we have to wait for the advice given to us by our advisors and the healthcare experts.
Okay, Congresswoman Kimbo, I mean, certainly we understand what the flexibility, we understand flexibility on the side of our policymakers and so on, and we wish we were that nimble. But the reality is neither our government nor our private sector are always that nimble. Especially now, nagigil lahat ng tao, no? Parang may opening ba akong umakyat ulit dito or buhayin na naman yung negosyo ko? Pwede ba akong for whatever, no? Either side of tourism, for example. And we invited you, of course, because you're an economist. I mean, how should government, do you think, be framing everything right now? Where on the one hand, we are trying to preach hope and trying to show that we're starting to open. And on the other hand, the past 2 weeks, everything has been signaling to us na, wait a minute, it looks like we may have to bite the bullet a little bit longer.
Well, Robbie, earlier you asked the question, how optimistic must we be? And at first I was thinking, maybe the word is guarded optimism. But then listening to everyone here, I thought that maybe the word to use is conditional optimism rather than guarded optimism. Meaning it's optimism that is conditional on having a plan and conditional on actually implementing that plan. So if we don't have a plan for moving forward, that optimism will just get thrown out of the window. So that's where I am today. If you ask me, what are the 3 top things that we must work on? In other words, what would be the key elements of that plan? First, I would say, and I'm sure everyone will agree with me, we need an efficient vaccine rollout. Let's do it as fast as we can, scale it up as fast as we can. In other words, address problems on logistics, address problems on vaccine hesitance, etc. Number two is having learned from our lockdown policy last year, I think we need to calibrate our lockdown policy. Clearly, with the surge in new cases, we're going back to our July, August levels. Inevitable ang lockdown. But we need to have a better lockdown policy, meaning a localized lockdown policy rather than a national blanket lockdown. And it has to be localized, it has to be at the barangay level. There has to be clinical triggers, meaning we have to ask our friends here, our doctor friends, if an LGU breaches, for example, X new cases per 1,000 population, sorry, you have to be MECQ. Or if you breach Y new cases per 1,000 population, sorry, ECQ. Or if you improve, then you go back to MECQ, and so forth and so on. So I think we need that. And so wala nang, I remember there were situations when the mayors had to actually vote on whether they would have a stricter lockdown or not. I don't think they should be subject to voting. It has to be subject to epidemiological triggers. So I think that's where our experts can come in. Number three, no lockdown, whether it's a scaled up lockdown or a localized lockdown, no lockdown will work without cash assistance. Why? Robbie, Cheryl, most of our workers are no work, no pay workers. So if they're locked down at home, gutom yan. Walang ipapakain sa pamilya. And more importantly, kung nagkasimptomas ka ng COVID, naka-lockdown ka, magpapa-quarantine ka ba? Knowing that if you go to a quarantine facility, then you miss out on earning and feeding your family. So, kailangan talaga ng increased government spending. And that's the reason for why I never stopped pushing for more government spending. I never stopped pushing for economic stimulus.
Congresswoman, I think that's a cue to bring in our experts. So, I mean, if our public health experts would like to jump in. But let me just quickly get to your three conditions and ask you yes or no questions for each one. Number one is vaccination. Are you saying wait for vaccination? Are you saying wait for a certain time or for a certain level? Two, a calibrated lockdown. Are you saying that granular right now, which is the current policy, is enough, not enough? What exactly is your assessment of granular lockdown? And you said three, cash assistance. Are you saying it's not enough?
Well, okay, let's start with three. Cash assistance is certainly not enough. But under Bayanihan 2, Congress authorized a spending of 165 billion. 25 of that is standby fund. But, Robbie, 55 billion of the 165 billion is for loans. Robbie, walang uutang ngayon na MSME. Takot lahat. So, a third already of your Bayanihan 2 is, at this point in time, sleeping funds, right? And only 6 billion ang ayuda under Bayanihan 2. Napakakaunti ng 6 billion. So that's cash assistance. Number two, right now, more or less granular ang lockdown policy, pero kulang ng automatic triggers. It has to be a clinical trigger. All right? So for me, hindi yan pwedeng pagbutuhan. Kailangan science-based, it's based on, again, epidemiology, right? Pag umabot ka ng a certain thresholds, walang tanong-tanong, matik yan. And that has to be known by everyone. So pagtutulungan ng lahat, everybody is on board, magiging incentive compatible siya, di ba? Your last question is...
Vaccination. Are you saying we wait?
Oh, absolutely not. Absolutely not. Now na. Dapat kahapon pa. Dapat last month pa. We have to do it now. I keep telling...
No. I'm not asking if we should wait for vaccination. My question is, should we wait for vaccination to kick in to a certain level before we more aggressively open the economy?
I think they can be done together. So as we keep scaling up inoculation as we go along, and if you have a granular lockdown policy that's based on clinical triggers, I think both can work sabay, right? So if you happen to belong to a barangay na natamaan ng COVID for whatever reason, ano muna tayo dito, close down na muna tayo dito, 'di ba lahat? Pero meanwhile, tuloy-tuloy pa rin tayo mag-inoculate. So I think dun sa question number one, there's clearly a balance.
Robbie, can I chime in?
Yeah, go ahead.
Yeah,
Dr.
and
Ted.
you told me to disagree if I disagreed with someone. And I'm telling you now, this is what happened last year. Last year, we issued a lockdown and said we will issue social amelioration funds and give it to people. What did I see? I saw local chief executives worry more about distributing this social amelioration fund, causing mass gathering events, and then forget about the build-up of the prevention measures, of the the detection, the contact tracing, and the labs. I think we sent a wrong message then. I think if you look back, if I'm going to reboot that, I would change that, and I would make sure that I'd incentivize following public health policies in the local governments. So nakita niyo yan, even the DILG has now stated they filed cases against some people kasi nawala yung pera. Nawala yung pera na dapat for social amelioration. So to me, that's the balance I'm talking about. And I'm talking about that from the point of view of my expertise in disaster medicine. What is disaster medicine? Our job is to make a bad situation from getting worse, right? So that's basically what you do. You're already in a chaotic situation. How do you do that? Risk management. You analyze risk. You're asking for things to like triggers or indices. That's not sure. That's unknown. None of our experts were able to give me that trigger because we're learning. It's an evolving science. But what we know is that we can use the level of risk to do our own singular, personal, individual actions to prevent us from getting risk. Wearing a mask, wearing a face shield, trying not to. So this is something that we need to put in the equation because I believe it's health and economics talaga. We missed out on that because we said, health muna, tapos hintayin natin when the health problem is solved, let's fix the economy. I think now, it should be together. Those two are married. We need to handle it through risk management. So the idea of balancing, and I agree with the idea of opening a little tourism and domestic tourism. I agree with pushing the vaccines. I agree that these two things has to be looked at together. Because the problem is we have experts who are infectious disease people, we have experts who are economists, but someone has to look at this from a very big picture. And I know for a fact, in the IATF, they debate this every time. Long debates on how to do it. But I think we're missing the point on making sure that we analyze risk. And the trigger should be, like for example, during the pandemic, I tell my children, oh, the malls are open, we can eat in a restaurant. I'm inviting them. My own daughters said, no, Dad, we'll just order food. And they do it online, they do it on their phone. I actually spend less. And I feel that my children understand the safety of that issue. So that's the type of thing I think we need to insinuate to our mga tao sa barangay. Kasi sa tao sa barangay, nakikita mo, they do not behave like that. So what's the problem? It's health literacy. We need to educate the people more about how this disease spreads, how we can prevent it, how we can manage this risk of getting this illness.
But all of that is fine. I mean, I think I come from a position of, look, 3 weeks ago we were giving people credit. 3 weeks ago, and from Christmas time, from Christmas when we were waiting for a surge and expecting a surge, the surge didn't happen. And we were giving each other a pat on the back. And government was telling people, good job. You see what happens when you behave? That was it. Tapos nung nag-surge ulit ngayon, I mean, my point is, isn't that precisely the point of Congresswoman Kimbo, that you still give the mandate to local government officials, for example, to call for but don't take away the political decision. Let it be triggered by hard data. I really don't get why any argument that we don't have enough. But because one thing that's improved over the past year is we now get the data quite fast. Diba? Dr. Beverly Ho, I mean, and the other, and I see Dr. Ko also, what are, to Congresswoman Kimbo's point, what makes that feasible? And what are the things that are in place that will actually allow us to lean more on science and data than political decisions?
I think there's already guidance that has been provided. In general, 2 is already a cluster, diba? And the guidance is that whatever the LGU, the administration of a particular enterprise, for example, has to crush the clusters, right? So when you get 2 cases in a floor, you make sure that you look for it there, do all the necessary interventions. When you get 2 in a street, then you lock down the street. When you get 2 in a particular home, then you lock down the house, di ba? Meron naman po talaga, no? It's really just a matter of how faithful are we in implementing these strategies. Hindi na po siya rocket science, and I completely agree with Congresswoman Kimbo that there are metrics that we need to follow.
Dr. Ko?
Yeah, no,
Robbie,
Anna
Robbie.
first.
Yeah.
I think Anna was
Okay,
trying to
sorry,
chime
sorry.
in. Ladies first, Anna.
Thank you. I was just
Before
going
I
to
agree
pick up on.
with Congresswoman Kimbo.
Yeah. So I was just going to pick up on the points that Congresswoman Kimbo raised, no, that there should be metrics that are based on science. I think to be fair naman, the data that we need is being supplied regularly to the IATF by the Analytics Task Group. And these numbers are basically the triggers that allowed us to move from one level of community quarantine to another in the past few months. I think maybe what needs to happen is for people to be more hands-on in terms of moving their communities to maybe a stricter or a looser quarantine classification, because this is really quite dependent on, if I may say, the local chief executive and how the local chief executive is able to handle the situation. So I feel that picking up also on what Dr. Ho mentioned about this being a devolved system, a lot really rests on how the local chief executive perceives the problem and goes down to managing it. Because we can only give guidance and then some general policies, but it's impossible for national government to know the nitty-gritty in each area, in each barangay, or in each city or town. And the LCE, if that LCE is really hands-on and has a good understanding of the situation, will be able to do a lot in terms of moving his community forward and addressing the problems.
Okay.
And I was going to say, I was just going to say that I completely agree with Ted and Secretary Dizon regarding the national government being the looking at us from above, because but there should be somebody who is looking at you from below, and that's where I agree with Congresswoman Kimbo, and that was echoed already by both Dr. Beverly Ho and Dr. Anna Ongling, that this is something that the LGUs need to stick on, especially when you try to recalibrate. Well, we need to recalibrate. Let's review how we do the lockdowns, and this is something that can be pushed between science and economy at the same time. Okay. Because this is the lesson that we've learned in the past year.
I think Congresswoman Kimbo wants to just say something, and then we have Secretary Dizon who also who has an insight on this.
Well, Robbie, just a very quick comment. So, ang tanong ko lang naman, Robbie, is, okay, so assuming na meron naman talaga yung sinasabi kong may clinical triggers, ang tanong, parang, bakit hindi yata ginagamit for decision making, di ba? So bakit pinagbobotohan pa ng mga mayors in NCR, for example? And sa totoo lang, pag umiikot ako sa distrito, hindi ko ramdam yun eh. Na in barangays, when I go around and I really see an increase in cases, hindi ko naman nakikita yun eh, na nagkakaroon ng announcement na magla-lockdown. So siguro, ang pwedeng idagdag, kasi nandun na daw eh, di ba? Sabi ni Dr. Ho, nandun naman lahat na sinasabi ninyo. Hindi na kailangan i-reinvent ang wheel, nandiyan na lahat yan. So siguro na lang, kailangan siguro mas paigtingin pa natin ang implementation, particularly ang monitoring and evaluation. Yung gano'n yung feedback between new data that arises, outcomes, and then calibrating a new policy action. Parang tingin ko, parang yun yung medyo kulang pa. So baka pwede natin i-improve ang, I think that's monitoring and evaluation.
Robbie, thank you. Tama po yung sinabi po ng ating mga eksperto, lalo na si Congresswoman Stella. From the very beginning po, ang national policy natin ay national government enabled, local government led. Pinaka-importante po lang, dahil na-acknowledge po natin from the very beginning, ang laban po sa COVID-19 ay nangyayari sa syudad, sa munisipyo, sa barangay. Nandiyan po sa baba ang labanan against COVID-19. Hindi po siya nangyayari sa IATF level. Nangyayari po yan sa baba. Kaya po yung sinabi na triggers ni Doc Bev, ni Doc Ana, yan po talaga ang guidance na ibinigay ng IATF with the guidance of the experts. Ngayon po, kagaya po ngayon, no, makikita natin, dito pa lang po sa mga news natin kanina na in-announce, ang Quezon City po, ang Maynila, ang iba't ibang syudad, ay gumagawa na po ng mga localized lockdown. Whether they be street lockdown, barangay lockdown, purok lockdown, ginagawa na po yan. Ang importante din po natin kailangan maalala, nung pong July at August, ganyan po ang ginawa ng mga LCE natin, ng mga syudad natin. At yan pong response na yan, klaro po na nag-work po yon dahil napababa po natin ang kaso sa Metro Manila, halimbawa, from 4,500, bumaba po yan daily as low as 200, 300, bago nag-surge. So, ang importante lang po talaga, tama po si Congresswoman Kimbo, yung implementation ang pinaka-importante. Alam ko po, pagod na lahat, 1 taon na, pero tandaan po natin, no? Nandyan pa rin ang COVID. Nandyan pa rin po siya. Ngayon po, may mga bagong variant pa. So, kailangan po talaga paigtingin natin yung implementation natin sa baba.
Gusto kong tumalon, balikan yung sa vaccination. Dahil ito ang pinupush ng ating pamahalaan po ngayon, na kailangan maging efficient yung ating vaccination program. Pero ako, bilang isang Juana, si Juan na nanonood sa atin ngayon, nalilito, ano ba tong vaccine? Ano-ano tong impormasyon na naririnig natin na itong si AstraZeneca hindi pwede sa senior. Itong si Sinovac, naku, natatakot ako kasi galing China. Ay, hindi pwede naman kahit na may vaccine na, pwede ko pa rin hintayin si Pfizer or kung magkakaroon ng Moderna. Sa mga health experts po natin, natatakot, nakita natin yung mababang confidence sa pag-vaccine. Nung una, nagpalista sa mga hospitals, doon sa mga reports po namin, kunwari, nasa 500 na nagpalista. Nung nakitang Sinovac, naging 100 na lang yung may gusto. So, paano po natin papawiin, as health experts, you were saying na, whatever vaccine that we have, grab it. Yan yung, maswerte tayo na may vaccine tayo. Paano nyo po papawiin ito yung kalituhan ni Juan at ni Juana on vaccine? Dahil at the end of the day, di ba, kailangan natin magpa-vaccine lahat eh. Dr. Ko, go ahead po.
Yeah, I think this is something that we need to do on a personal level, one day, one person at a time. You know, I was one of those that, well, let's just say that a lot of people were hesitant to get the first shot. So the medical director of the hospital called me, asked me if I was willing to be the first one, and so that we can post it. And after we posted it, everybody in the hospital decided to go and get, because I was willing to get it. But you know, the message there is that we do it one day at a time, one person at a time, one conference at a time, one meeting at a time. And if I'm able to do that at no additional expense to the government, we're just making sure that even the lay get to understand what the benefit of immunization is. I think all of the doctors would have done a very good job. Because I've always told people that this jab, this shot, is not for me. It's for you. That's the only way I can protect everyone from COVID.
Father Nick.
Well, you know, so I've been vaccinated twice, and a lot of Filipinos are asking me, what was it like? So I think we have to be very honest with the experience. So the second shot of the Moderna was very challenging. So the next day, I was very sick. But I knew that I was only going to be sick for 24 to 36 hours. So 2 days later, I was completely fine. So I set up a team at UST. You can see the UST COVAX. And what we're doing is we have students who are collecting testimony. So Dr. Ko was very generous to give us his testimony and a selfie. And we're converting this into Instagram PubMats and spreading it through social media, because one of the things we have discovered is that you will not get vaccinated just because of the science. You need to have someone else you trust who got vaccinated before you. And what we're seeing now is that as the vaccine rollout is occurring, vaccine confidence is increasing in the Philippines as more and more Filipinos see their kababayans who are getting vaccinated. So it's not just the science. I'm a molecular biologist, I'm developing a vaccine, but what I've discovered, it's about storytelling. We have to tell each other the stories. I'm doing is, when I had my second shot, this is what the first thing that came into my mind. My mother is safe. So, so because I worry about my mom, she's 80 years old, and now because I have a second shot, I can visit her and I can visit her safely. And so we do this for our lolos and our lolas and those who are sick, just like Dr. Ko pointed out. And I think when we speak this way, it will complement the science, because the science is not enough. You have to talk about people, and people are scared. Now, unlike here in the United States, where it is vaccine ideology, what you have there is vaccine fear. So once people are reassured that others survived the vaccination, then they're willing to go out and get vaccinated. So we have to be telling each other stories about, yeah, it was difficult, but 2 days later, I'm fine, and now I can visit my mom, and I'm not worried about me transmitting the virus to her.
Doctor,
Cheryl.
very quickly, because I see Dr. Anna Ong Lim raising her hand.
Yes, Cheryl, so that's a very important question to raise, no? Since everybody realizes that vaccines will be an important role in bringing us out of the pandemic, then we need to make sure that maximum uptake is going to happen. And the points that have been raised by the different panelists are quite valid. We need to be able to address the concerns that people are raising. We're quite fortunate in that most of the questions that people are raising are very simple questions related to their own medical issues. Do I qualify because I'm 80? Do I qualify because I'm on dialysis? These are questions that have very simple, straightforward answers, non-controversial at all. And typically, when we have the opportunity to talk to them in various meetings, they come out of the meeting saying, okay, I'm going to get vaccinated. Where do I sign up? That's the kind of attitude we have, because probably also we in the Philippines, we're still quite used to seeing a lot of infectious diseases, and we know what it's like to get sick. So adding to what Father Nick has mentioned about trust, we do know that the vaccination program has taken some kind of a beating in the past, but seeing so many infectious diseases come along in 2019 with all the outbreaks, and now with COVID, I think people are quite ready to just give the system the benefit of the doubt and pick this up and take this up, because we all know we need it.
Robbie, Cheryl, no? Napaka-importante po nung sinabi ni Father Nick tsaka ni Doc Ana. Ito naman po ay karanasan natin itong nakaraang 2 linggo na nag-iikot tayong habang nag-roll out. No? Totoo po na nung una, mataas po ang vaccine hesitancy. Marami pong agam-agam ang ating mga kababayan. Pero alam niyo po kung anong napansin namin. Nung isang araw po ako'y nasa Bacolod, Iloilo at Gawag. Magkakasunod po na araw yan. At ngayon po, halos lahat ng mga bakunang dumating sa mga ospital ay taken up na po. No, lahat po ng ating mga healthcare workers sa mga ospital na pinuntahan namin noong nakaraang linggo, meron na pong nag-sign up para magpabakuna, regardless of brand. And I think ang pinaka-powerful po at pinaka-importanting rason dito, yung tiwalang binigay po ng pagpabakuna ng ating mga doktor at medical frontliners. Dahil po, tama po yung sinabi ni Father Nick, ni Dr. Ana, nung napaliwanag po ni Dr. Edsel Salvania, ni Dr. Gap Legaspi, at iba pong mga doktor sa buong bansa kung saan rinroll out yung bakuna, yung mga iba pong mga medical frontliners, sumunod po silang lahat. Kaya po napaka-importante po, hindi lang dahil kailangan talaga unahin ang mga medical frontliners dahil sila ang mag-aalaga sa ating mga magkakasakit. Pero napaka-importante nun sa pagbibigay ng kumpiyansa sa ating mga kababayan. Kasi pag nakita po ng isang ordinaryong Juan o Juana, ang kanyang doktor o ang kanyang barangay healthcare worker na nagpapabakuna na at nasasagot yung kanyang tanong, tingin ko po, tataas po ng tataas yung vaccine confidence natin sa mga susunod na buwan.
Before we go on a break, Congresswoman Kimbo?
Yes, ako rin. The last 6 weeks, umiikot din ako sa distrito dahil ang naging advocacy ko is vaccine confidence. So ang dami ko na pong nakausap, mga TODA, mga teachers, mga homeowners, nakausap ko na po sila. Tama po, no? Ang first is matindi po yung naging epekto talaga ng fake news.
Yeah.
Yun po, they've come to the false conclusion that if it comes from a certain country, that's no good. So, and then number 2, yun nga, tama, i-validate ko po yung sinabi ni Dr. Lim. Doon po sa amin, very simple yung mga tanong. Pwede ba ako, na matanda na ako, may allergy ako, buntis ako, may heart condition, etc. Very easy questions to answer. Ang pangatlo, na hindi pa nababanggit po dito is, they fail to, or hindi masyadong klaro yung nexus between the vaccine and economic recovery or yung connection ng economic recovery and vaccine. Halimbawa po, yung mga kausap kong tricycle drivers, tinatanong ko sa kanila, bakit ayaw niyo magpabakuna? Kung ayaw niyo magpabakuna, hindi tayo magkakaroon ng face-to-face classes. Kasi mga school children natin, low sila sa priority list. So kung ang sinasakyan nilang tricycle ay hindi na bakunahan, talagang mahihirapan tayo mag-decide to allow face-to-face classes to come back. At pag nakita nila na may connection pala yun, that they have to conquer their fears, they have to conquer their false information, because doing so would mean there's a greater common good. Doon nila nare-realize that this is something that they need to do, not only for themselves, not only for their families, but also for the community.
At ngayon, nasa priority list nga, Robbie, nauna yung ating medical workers. Tapos si Juan, balikan ko si Juan at si Juan, kailan na ako? Yung gusto na magpa-vaccine, kailan na ako magpapa-vaccine? Kailan ako dahil nga, sabi, dahan-dahan na dumadating na po yung ating mga vaccines. Yun ang gusto nating itanong sa ating pagbabalik din. Gaano na ba kabilis yung pag-roll out ng ating vaccination program? More discussions and insights when we return. This is Kumusta na ba tayo? A One News Town Hall on the COVID-19 pandemic. Stay with us. Nagbabalik ang Kumusta na ba tayo? Town Hall sa panahon ng pandemic. Patuloy po ang ginagawang pagbabalanse sa kalusugan at ekonomiya habang nagsisimula na ang pagbabakuna sa ating frontliners. Saan na nga ba tayo patungo?
Abot tanaw na nga ba ang pagbangon ng ekonomiya o marami-rami pang hamon ang dala ng pandemya? Hindi na nga ba tayo makakabalik sa panahon ng pre-COVID-19? Will this so-called new normal be a lasting normal for generations? We'll discuss the crucial game ahead that this pandemic has brought us to, the balancing act. Okay, let me ask Yusek Bengzon, Undersecretary Bengzon. I mean, what's the road ahead for us? I mean, immediately, some of our guests and our guests now have, even from government, even from private sector, have acknowledged, I think more than they have in the past weeks. They've acknowledged that, yeah, we may need to recalibrate, we may need to rebalance, we may have to be more sensitive to what the data is telling us right now. But coming especially from a very vulnerable sector, talagang tinamaan talaga ang turismo. Ano pong nakikita nyo? Nasaan po ang balancing act natin dito?
Well, Robbie, yung pinakamahalaga dito, no? Paulit-ulit din namin sinasabi, we have to make sure that we comply with the minimum public health standards. And dito po sa tourism, we have always maintained a safe but slow approach, no, in reopening our different destinations. Kasi nakikita din natin na kapag tinamaan isang destination, magkaroon ka ng kaso dyan or ng surge, balik ka ulit sa square one. Ayaw nating mangyari ito. So, ang balance dito, kailangan siguraduhin lang natin that number one, on the part of the traveler, no, he complies with the minimum health and safety protocols. On the part of the service provider, meaning the hotels, the transport companies, no, the tour operators, kailangan din sumunod sila dun sa mga guidelines, no, that we have crafted for their operation. So it has to be full cooperation between the traveler and the service providers. Ang lagi po naming sinasabi, no, the travelers under a new normal will have to be more patient, more understanding, and more cooperative, because the systems and the protocols under the current situation are obviously different from how they were before the pandemic.
Yeah, and Yusek Bengzon, I'm glad you acknowledged that, because tinatanong ko to because I do want to bring in something that was brought up by Okta Research, particularly Dr. Guido David, the other day when he guested sa the Chiefs. We were talking about Holy Week. And we were talking also about, ano naman dito, Yeng, di ba? Pagka sinabi yung Holy Week, people are already dreaming of going to the province, di ba? And okay, bakasyon. But we were also talking about it in the context of, paano if we need to talk about a lockdown? And on the other hand, the private sector is saying, no more lockdown. No more lockdown. We can't take that. And I think all of us acknowledge the difficulties on both sides. But Dr. Guido David said, I've actually been floating this idea of what if we call for a 2-week Holy Week? In other words, don't frame it as a lockdown. Don't frame it as ECQ. Frame it along something cultural, along something even about faith and about family and about self-sacrifice and self-responsibility. Maybe people will be open to staying at home. But then that will impact tourism. And that's why I was asking, what does that mean for the tourism sector? I mean, Vince, what do you think of that? A 2-week Holy Week?
I think, like we said, flexibility is key to the response to the pandemic. And in a situation where there is a surge in cases, in a situation where hospital occupancy is getting up there to critical levels, these ideas, these out-of-the-box ideas, I think should be considered. But of course, they have to be guided by the pool of experts that we have. And I'm sure the IATF would consider out-of-the-box ideas such as this. No? But I'm still, I'm not ready to say that, it's a good idea, we should do it. We still need to look at what's going to happen in the next couple of days. Anyway, ang Holy Week naman, 2 weeks pa. Siguro may oras tayo para pag-aralan to and then mag-desisyon kung kinakailangan.
Yeah, but Yusek Bengson, I want to give you some time to respond to this because obviously this has implications. Either way this idea goes, this has implications for the tourism sector. What do you think?
Well, I have to make it clear also, Robbie, that the decision to open domestic destinations is made by the local chief executives. Sila po nakakaalam ng sitwasyon sa kanilang lugar. Kaya nga meron tayo mga instances that an area is already under a modified GCQ. Pero kung sa tingin ng local executive ay hindi pa ready yung destination na magbukas, hindi pa sila nagbubukas. Sa amin naman po, ang cooperation na ini-extend namin would be for those destinations that have already agreed to reopen for tourism. But we certainly agree that the next 2 weeks will be very crucial, and it becomes even more important for us to make sure that everybody faithfully complies with the health and safety protocols.
And to our experts, siguro mamaya po pasagot natin sa Holy Week, everybody's planning. Actually, karamihan may plano na, mga nakabook na yan. Pero from our health experts, siguro kung talagang balak nila umuwi ng probinsya, gustong magbakasyon or staycation man yan, ano na lamang din po, since hindi na natin din sila naman mapipigilan, at the same time nakakatulong yan sa tourism industry, ano yung bilin na lang ng ating mga health experts dito sa mga pupunta sa mga probinsya o lalabas ng kanilang tahanan. Pero bago po yan, para lalo pang palawakin ng ating usapin, ilang personalidad mula sa various sector po ang nagsumite ng kanilang tanong. Unahin natin ang mula sa hospitality industry. May tanong po ang General Manager ng The Linden Suites na si Tet Romualdo. Pakinggan po natin.
Good evening, this is Tet Romualdo from The Linden Suites and HSMA. My first question is, what plans do DOT have to address the recovery of the hotel industry, specifically in Metro Manila, where a surge of COVID cases is seen? As a follow-up question, how can DOT stimulate the market to bring back travelers to NCR the way it promotes other destinations? Is there a national or international MICE campaign in the works to revive the industry once the lockdown is lifted? That's all. Thank you very much.
Yusek Bengzon.
Yeah, well, thank you for the question. One of the forms of assistance that we are extending to the private sector would be the granting of working capital loans under the CARES for Travel program of the Small Business Corporation of the Department of Trade Industry. So in a way, this provides a lifeline to those distressed companies whose revenue stream has been affected severely over the past 12 months. On the matter of supporting the hotels in Metro Manila, we are now reviewing the guidelines for the operations, particularly of staycation hotels, because we want to provide opportunities for the hotels to expand their operations and also to increase their income. So hopefully the guidelines will be completed maybe within the next 2 weeks, and we can share this with our partners. And on the MICE campaign, yes, Manila continues to be a major MICE destination, not only around the country, but also around the region. So we have a MICE roadmap. It's called the MICE Roadmap 2030, and we are likewise committed to making sure that the MICE industry is given all the financial and technical support that it needs, especially during this difficult period.
Okay. Salamat po, Undersecretary Bengzon. Ngayon, pakinggan naman natin tanong ni Mr. Alan Tanhusay. Siya po ang spokesperson ng Trade Union Congress of the Philippines and Associated Labor Unions.
Unang-una, paano ba natin mapapataas o mapapanatiling mataas ang purchasing power o ang buying power ng kasalukuyang minimum wage rate dito sa ating bansa? Ikalawa, paano ba tayo makakabalik sa dating normal? Ikatatlo, paano ba nating mapapanatiling affordable ang presyo ng mga basic commodities at halaga ng serbisyo dito sa ating bansa.
Napakaraming tanong. Buti na lang si Congresswoman Kimbo alam lahat ng sagot.
Well, Robbie, at buti na lang din po, yung first at saka yung third questions ay isa lamang ang sagot. Which is, paano natin patataasin ang purchasing power? Ang sagot po dyan is, pababain natin ang presyo ng pagkain. Napakataas po ng food inflation sa ngayon. Ang dahilan po niyan is because nagkaroon ng supply side disruptions. In other words, maraming crops ang nasira. Marami din mga baboy ang namatay ng dahil sa ASF. So COVID na, ASF na, nabagyo pa. So nang dahil doon, talagang na-disrupt ang supply. At kapag mababa ang supply, napakataas ng presyo. So that's the first. We have to address that. Hindi simple ang pag-address niyan. You need to have several policy actions there. Kasama dyan ang kailangan ayudahan ang farmers, kailangan ayudahan ang ating livestock producers. In other words, we need to give them cash assistance, straightforward grants, hindi po utang ang kailangan ibigay, straight grants talaga. Nang sa ganon, ang kanilang working capital ay ma-replenish. Ang sa akin din po kasama dyan, dapat po babaan ng kaunti ang tariffs. Napakataas po ng tariffs. Nang sa ganon ay napakataas ng smuggling. Kapag napakataas ng tariffs, unreasonably high, nagkakaroon ng malaking insentibo na mag-smuggle ng imported pork. So yun yung related na first and third questions. Ang pagdating naman sa number 2 is ano daw ang kailangan gawin para sa new normal. Ang sa akin po is kailangan natin bigyan ng assistance din. Kailangan natin ayudahan ang ating MSMEs. About 96% of establishments are MSMEs. Karamihan sa kanila ay informal or nasa underground economy. So hirap po sila to cope with itong new normal. Ano ibig sabihin ng new normal? Yung simpleng tindahan ngayon, baka kailangan online na ang kanilang selling platform. Paano nila gagawin yun, di ba? Ang isang malaking problema is ang baba ng financial inclusion. 77% of Filipinos are unbanked. Wala po silang access to the formal financial system. In other words, even if you increase tremendously the amount of loanable funds in the system, wala pong makaka-access niya ng malawakan dahil napakarami pong walang bank account. So we need to provide again grants for our MSMEs para matulungan silang tumayo ulit. And once they're able to do that, hopefully, when they're a little bit more viable, then they can now access the loans.
And at this point, News 5 Chief Correspondent Ed Lingao wants to ask our guests. Let's hear it.
Well, the fact that it's a pandemic means that it's almost unimaginable for anybody to make political capital out of what's been happening in the last 12 months. But that's precisely my question. In your opinion, has anybody or have any groups politicized the pandemic issue in the last year, and to what degree? And also moving forward, next year is an election year, and we do see vaccinations to ramp up before the end of this year. What is to stop any group or any people, any person from making political capital out of the vaccinations?
Who wants to answer that?
Walang nagtataas ng kamay. Kanina dami nakataas ng... No, but I think, Secretary Dizon, I think it's a fair question. I mean, how do we ensure, let's frame it this way, how do we ensure that all of this is not politicized? Alam niyo na, malikot din mag-isip ang mga Pilipino. Bakit nadidelay ang bakuna? Pagdating ng bakuna, we will be in the middle of election season. I mean, how do we ensure that none of this is going to be politicized?
Very clear po ang directive ng ating mahal na Pangulo. Walang politika po dito. Tayo po ay nasa gitna ng isang napakabigat na laban. And ito po yung laban nating lahat. No? Regardless of kung saan ka sa politika, Pilipino ka. So, ano po ito? Hindi po natin papayagan na magamit ito sa politika at hindi papayagan ng ating Pangulo.
Well, Robbie, we're running out of time at 7:54. Siguro, at this
That's the
point.
right message.
Final words or paalala? Again, Holy Week is coming. May Holy Week pa tayong gustong pag-usapan sana eh.
Okay lang yun, may Chiefs naman bukas.
May Chiefs bukas, babalik na lang. Pero siguro po, parting words?
Yeah.
Well, my parting words is that our battle, the virus is still here. We even have new variants that are here. So what we've done last year was good. Let's continue to do that and even more, get vaccinated. I think the vaccines are coming now. We have 1 million doses that's coming at the end of this month. And then several more that are coming and be rolled out. So I think dapat talaga magpabakuna yung mga tao, intindihin kung paano kumakalat at iwasan yung mga gawain na pwede pang magkalat ng virus.
Secretary Dizon, can I prompt for your final word something that Dr. Herbosa said? Could you touch on a more detailed schedule of our expectations for when the vaccines will arrive beyond the end of this month? Ano po yung ini-expect natin na sure ball?
Alam niyo ho, si Secretary Galvez po ay bumalik na galing India. Ayoko pong pangunahan yung kanyang balita, pero tingin ko po maganda ang kanyang ibabalita bukas sa ating mga kababayan. Pero sa aming pagkakaalam po is meron pong padating na bagong batch ng mga bakuna bago matapos ang buwan ng Marso. At dahil po dito is lalapit na po tayo dun sa punto na mababakunahan po natin lahat ng ating mga healthcare workers. Roughly po mga 1.7 million po yan. So kakailanganin natin ng mga 3.4 million doses. Pagkatapos po nun, susundin natin ang ating mga senior citizens at vulnerable population. At dahan-dahan po siguro, hopefully, sabi nga ni Secretary Galvez, is by the second half of the year, ay magsisimula na po tayo sa general population natin.
Okay.
At yan po talaga ang nagbibigay sa atin ng pag-asa. Alam ko po na medyo nahihirapan tayo ngayon dahil sa pagtaas ng mga kaso, pero gaya po ng nasabi kanina, naranasan na po natin to last year. At na-address po natin to dahil nagsama-sama tayo, in-enforce natin ang ating strategiya down to the barangay level, at nababa po natin ang kaso. Tingin po natin, ngayon na nagsimula na rin tayong magbakuna, meron tayong dagdag na armas, laban sa COVID-19. Kaya po sana kung magsasama-sama tayo, kagaya ng ginawa natin last year, kakayanin din po natin.
Okay, so before we get to the final words of everybody else, just very, very quickly, where should we be, percentage-wise, in covering the general public by the end of 2021? And when can we expect to have achieved a level of herd immunity?
Ang target po na sinabi ni Secretary Galvez ay at least 50% ng populasyon natin ay mabakunahan na natin by the end of 2021. So mga 50 million Filipinos po yun. And sinabi naman po ng mga health experts natin na ang herd immunity ay magkikick in at the 65% level of the population. So pagdasal po natin, magtulungan po tayo despite yung mga challenges sa supply ng bakuna worldwide, pipilitin po nating maabot yon sa end ng 2021.
Okay, Undersecretary Bengzon?
Well, salamat, no? Siguro ang mensahe lang namin, suportahan po natin ang safe and restart recovery of tourism. Isa lang naman po ang ating pakay dito, no? Maibalik yung kabuhayan ng ating mga kababayan na tinamaan itong pandemya. So tulungan po natin sila. Maraming po salamat.
Congresswoman Kimbo?
Ang pinag-usapan natin ngayong gabi is really the tension between buhay and kabuhayan or health and economy. Ang sa akin, the key to balancing those two is really science. Mababalanse mo yan kung ang decision-making natin is nakabase sa siyensya, nakabase sa datos. Yung 2-week, halimbawa, 2-week Holy Week, para sa akin po, that's equivalent to a 2-week national ECQ. So ang tanong ko dyan is, base ba yan sa siyensya? Nakabase ba yan sa datos? Bakit 2 weeks? Bakit buong nation kailangan natin gawin? So sana po, yan ang ating guiding post. And at the same time, kung science-based ang ating decision-making, wala pong mapupolitika.
Okay. Father Nick?
So I'm a scientist, but I'm also a priest. And it's been a very long Lent. It's been 1 year of Lent. And the Lent continues. But I think, as the other panelists have pointed out, the vaccines are on their way. And I think it's important to highlight that a significant point will arrive in our country when these vulnerable senior citizens are vaccinated. So even if we do not attain herd immunity this year, if we are able to protect the most vulnerable, our lolos and lolas, there will be a significant change in the way we can manage the pandemic because we will have protected and shielded them. So I'm hopeful that by the end of by Christmas time, things will feel different even without herd immunity, only because the most vulnerable amongst us will already be protected. And the last thing, every Lent always ends in Easter, and that is what we are praying for now.
Dr. Beverly Ho.
I think it's important that we all recognize responsibility and our role in curbing the current surge, and more importantly, also our role in influencing others, whether that's explicit or hindi natin aware, that we're influencing people around us. And that goes with both reducing transmission or reducing contact rates with others so that we don't become agents or passports of the virus. But then also in making sure that we only talk about verified information when we discuss about vaccines with other people. If we're not sure about certain things, then we probably shouldn't be saying it out loud and take time to verify it first kasi very delikado po siya. So yun lang po. Let's all do our part both in MPHS, minimum public health standards, and in making sure that we collectively increase vaccine confidence in the country.
Okay. And Dr. Anna Ong Lim.
I think I'd like to end with an appeal to everybody. Alam ko lahat tayo pagod na. We're all just really fed up with not living the way we used to. And I think it's good to acknowledge that kasi hindi talaga normal yung pinagdaanan natin. Pero yung pinagdaanan natin itong nakaraang taon, masasayang to lahat. Kung itong home stretch na hinahabol natin bago makarating ang bakuna, hindi pa natin pagtsatsagaan yung mga kailangan natin gawin. Malaki ang hinihingi natin sa isa't isa, no? Na magtsaga pa ng konti, magtiis pa ng konti, bunuin pa natin yung kailangan natin gawin para malampasan itong surge. Pero tulad nga na nasabi kanina, meron na tayong bagong armas, nandiyan na yung bakuna. So siguro konting kapit na lang, pagka nakarating na yung mga bakuna, medyo nalampasan na natin to, pwede na natin ulit pag-isipan yung mga gusto natin gawin. And hopefully, hindi lang new normal yung aabutin natin, better normal. Kasi gusto nating natuto na tayo dun sa mga pinagdaanan natin.
Okay. 1 year.
1 year.
And then
Anniversary.
And we have a lot to reflect on. Maraming kailangan pagnilayan. Marami rin tayong natutunan at marami rin naman talagang rason to remain hopeful. In the meantime, we'd like to thank everybody. We'd like to thank all our guests for their patience as well. It was not easy, even with 2 hours, na maipasok lahat. And we'd like to apologize if we could not accommodate everything and everyone. Pero maraming salamat po.
Thank you for joining us. Maybe we should, sana sa susunod na pagbabalik natin,
bukas yun.
Ay, ikaw sa shifts. Pero sana maraming natutunan din yung mga kapatid natin na katutok sa atin. Sa pagpasok po natin sa ikalawang taon ng pandemya, sana ay baon po natin ang mas malalim na pag-unawa sa ating sitwasyon at pagkakaisang malampasan ang krisis na ito. Magandang gabi, ako po si Cheryl Cosi.
At gaya po ng lagi natin sinasabi, mask on, wash hands, and stay safe, Philippines. Ako naman po si Robbie Alampay. We are One News. Good evening.